Hello, my name is Edivan Ferreira. I am physiotherapist and pharmacist. We will talk about things about Brazil that the world doesn't know. Today we are going to talk about Brazilian public health. Well, the 1988 Constitution guarantees a Brazilian the right to health as a duty of the state. The rights materialize in public health by the SUS is called Sistema Único de Saúde. And this offered many services, how human milk banks, sex change surgery, repair surgeries for women victims of violence, treatment for hepatitis C, copper IUD, HPV vaccine. For the people with HIV, it's offered medicines and other services. The person living with HIV positive or with severe liver disease will be entitled to the benefits without having the complete with the minimal contribution period and provided that he or she is insured in the Social Security. The sickness benefit cease to be paid when the insurer regains capacity and returns to work, or when the benefits turns into disability retirement. In this case, the granting of the sickness benefits will occur after proof of the incapacity in medical inspection by the Social Security. We have emergency hospitals, rescue units called SAMU with ambulance, offer car to take people to the hospitals. We have eye care with surgery and medicines too. Surgical center for many types of health problems. A lot of exams, tomography, MRI, X-ray, laboratory tests, rapid tests for HIV, syphilis, and hepatitis. We have health posts with doctors, nurses, dentists, health agents, vaccines, pharmacies, and medicines for various types of disease such as diabetes, hypertension, infections, inflammations, cough, fever, cholesterol, skin problems, and gynecological problems, as well as pill and contraceptives, injections, and condoms. There are also social assistance centers helping the needy, elderly, women, and children victims of violence. We also have physiotherapy services in hospitals, intensive care unit, and specialized centers. And here in Brazil, the physiotherapists cover several areas of the activity, as motor physiotherapy, traumatology, neurological, respiratory and cardiac physiotherapy, hydrotherapy, and others, totally free. The government offers psychological and psychiatric treatment, hospitalization, and rehabilitation clinics, as well as their medicines for each case. For pregnant women, there is pregnancy test, prenatal follow-up, basic food basket during pregnancy, delivery, and all the necessary services for the comfort of the mother and the babies. We have treatment for cancer, diagnostic exams, chemotherapy, radiotherapy, and surgery for cancer. We have a service of organ transplantation, bone marrow transplant, blood transfusion, and expensive medicines offered by the state. And if the state does have these medicines or other things requested, the citizen can file the lawsuit and get in the court, since health is a state obligation. The previous president has brought doctors from Cuba to attend in various parts of the country to help the population and to fill the gap in places that Brazilian doctors refuse to go. Now the Cubans are gone, unfortunately. Sometimes it takes a while for you to find vacancies, and sometimes the treatment is immediate. Many people prefer to make health plans because they have more accessibility, more medical specialties, and better hospitals. But often, the SUS offers care in private hospital, and the citizens does not have to pay anything. About our medicines, we have public pharmacies and private pharmacies distributing government-paid drugs. Often, people do not want to go to the doctor because they sometimes delay and prefer to go to the private pharmacies and buy their medicines without help of the government. That was a summary of what we have here in Brazil. So, when you heard that Brazil is a bad country, don't believe it. Brazil is wonderful, but the Brazilian people are ungrateful, unfortunately. If you like this video, don't forget to subscribe, share with your friends, and kiss. See you next video. Bye.